Okay. Good afternoon. मुझे कैमरे में देखना चाहिए, राइट? मैं बहुत बार नीचे दिखता हूँ. Okay. So how are you? Welcome to this class. Yesterday we could not complete the ear anatomy because of the power cut. So मैं इस क्लास में ear anatomy एक बार कवर करता हूँ. And then we will go to next section. बहुत लोगों ने रिक्वेस्ट किया था कि हाउ वी कैन यूज साउंड थेरेपी विद ईयर एक्यूप्रेशर. तो मैं इसके बारे में बात करूंगा और अगर समय मिला तो कुछ 5 एलिमेंट्स, ऑर्गन्स एंड ऑरिकुलर थेरेपी एक टॉपिक ओवरव्यू दे सकता हूं. सो लेट्स स्टार्ट. Let's go to ear anatomy first. Let me share my screen. ओके, ईयर एनाटॉमी. आपको जैसे मैं एक्सप्लेन करूंगा आपको आपका कान पकड़ना है और ईच पार्ट आपको फील करना है. ठीक है, एक बार ये एक्सरसाइज हम सब मिलकर करेंगे. सबसे इंपॉर्टेंट इजी पार्ट इज लोब, राइट? So everyone take both of your hands and pinch your lobe. Ear lobe or lobule is a soft part. तो soft part है ना, बहुत इंपॉर्टेंट है, ब्रेन का एरिया. सॉफ्ट पार्ट इज अ ब्रेन एंड फेस एरिया. ठीक है, सो आप सब लोग ईयर पकड़ो और इसको मसाज करो, राइट? फर्स्ट पार्ट ईयर लोब. नाउ लोब से ऊपर जाके जो आउटर पार्ट है ना, आउटर पार्ट विच इज वेरी सॉफ्ट एरिया. सो सॉफ्ट एरिया में आप जाओ और इसको पकड़ो. सो एवरीवन पिंच योर लोब फर्स्ट. लोब के बाद में साइड से आप सॉफ्ट पार्ट पकड़ते जाओ, ऊपर तक जाओगे आप, राइट? ऊपर से आप अंदर नहीं जा सकते, आपको हाथ आगे करना पड़ेगा. एक बार ना मैं पहले मेरा स्क्रीन दिखाता हूँ. ओके, सो let me show my screen. We have to pinch our lobes. So lobe है soft part, इसको pinch करो, ear lobule. फिर आप साइड से ऊपर पकड़ते जाओ on the top and you can go inside if you pinch. Like यहाँ से पकड़ के जाओ ऊपर तक और यहाँ से अंदर आ सकते हो. So from this, if you go side, it is like a C-shape area. C-shape, that is called as helix. It is a soft part. बहुत important है, बहुत important. How many of you are already using ear acupressure? Are you using the ear lobe, ear helix part? आपने हेलिक्स पार्ट के पॉइंट्स का यूज किया है क्या? बहुत इंपॉर्टेंट. It helps to restore the blood supply so that it helps for healing, to get more energy to that area, to reduce the excess. Yes, bleeding we use it for bleeding, but I have innovated some ideas कि बहुत लोग bleeding नहीं चाहते, they don't want blood on the ear, right? As a patients, therapists also they don't want to do bleeding because they are not confident. So bleeding is the best way. लेकिन जो लोग और हेलिक्स पे ब्लीडिंग नहीं कर सकते, they can use a simple massage, number one, for the better blood supply. Number two, they can use the seed therapy, needle therapy, to increase the blood supply, to increase the nerve connection. तो जिनको numbness है, हाथ में numbness है, find out the exact spot of which nerve is involved in the spine area, anti-helix, and find out the exact point on the helix. That will help to reduce the numbness. Similarly, जहाँ पे पोषण कम है, when an athlete needs more energy in the thighs, you can see the thigh correspondence on the helix, and you can apply seed or needle on the helix corresponding to the thigh area. ठीक है, बहुत सिंपल है. जो एरिया आप देखोगे कान पे, उसका करस्पॉन्डिंग एरिया आपको उसी लाइन में हेलिक्स में मिलेगा. ठीक है. So it is always better to use helix in your treatment protocols. प्रोटोकॉल कैसे बनाएंगे, क्या क्या ऐड करेंगे, एवरीथिंग वी विल बी कवरिंग नेक्स्ट वीक व्हेन वी कवर पॉइंट वाइज सिलेबस. ओके, सो लेट्स सी. लोब के बाद में आता है हेलिक्स. दिस इज लोब, दिस इज हेलिक्स. आफ्टर दिस, anti-helix is a Y-shaped structure. It is also a curved shape like helix. हेलिक्स के जैसा ही एंटी-हेलिक्स है, Y शेप है. ठीक है, आप अभी ऐसा करें, आपके जो इंडेक्स फिंगर थंब है उससे हेलिक्स से अंदर जाके एंटी-हेलिक्स को पकड़े. हाउ डू यू आइडेंटिफाई एंटी-हेलिक्स? हेलिक्स इज अ सॉफ्ट पार्ट, है ना, हेलिक्स सॉफ्ट होगा. उसके बाद में इफ यू गो इनसाइड, और एक सॉफ्ट पार्ट मिलेगा विच इज अ डिप्रेशन, and then it is a semi hard part which you will feel, that is your anti-helix. Okay, so from bottom to the top, just find out the anti-helix, and if you see, if you can feel the Y shape of that anti-helix. सब लोग करिए. You can start with lobe, you can then go to helix. हेलिक्स के बाद में एंटी हेलिक्स, राइट. सो एंटी हेलिक्स आपको फील होगा. टेक योर टाइम. ये करने के बाद मुझे बताइए कि क्या आपको आपके फिंगर्स को महसूस हो रहा है. जिसको महसूस नहीं हो रहा है वो हैंड रेज करे या फिर मैसेज करे. If you feel it is not helping you, raise your hand or message in the message box. How many of you can? Sorry, how many of you cannot feel? How many of you cannot feel? Okay, how many of you can feel? आप hand raise करिए. Okay. Okay. Right. जिनको नहीं आ रहा है, जिनको नहीं आ रहा है, आप अगर इफ यू कैन सी माय वीडियो क्लियरली, मैं एक फिंगर से पूरा एंटी हेलिक्स को आपको दिखा देता हूं. यहां से पकड़ के आप स्लोली ऊपर जाएंगे. इट्स अ सेमी हार्ड पार्ट. अगर हेलिक्स सॉफ्ट है तो एंटी हेलिक्स सेमी हार्ड है. एंड वहां से आप नीचे के एंटी हेलिक्स को, इट इज लाइक अ रेजर, इट इज अ शार्प एज. एंड ऊपर का जो जनरली है, इट इज लाइक अ पाइप के ऊपर आप रखोगे तो कैसा लगेगा, वैसा आपको ऊपर के यहाँ पे लगेगा. सो ट्राई इट अगेन एंड लेट मी नो हाउ मेनी ऑफ यू फील नाउ. Right? Okay. So anti-helix is the most important part in auriculotherapy. Why? तो ये बताएगा why it is very important. Yes, सुनता जी, एक मिनट. You can turn on your microphone.
So it is related to spine, that's why.
Vertebra,
Correct.
vertebra's
And-
correspondence is there.
And spine और क्या है?
Leg.
Legs. Yes, spine and legs. And mostly we
Spine
have
and legs.
problem. Right? We have patients of spine, neck, shoulder, lumbar pain, leg, जैसे कि pain in knees, pain in heel, right? So that's why it is very important to learn the anti-helix very well, very well. And आप इस anti-helix पे spine के accordingly you can have points for each spine. आप हर spine के लिए एक point ढूंढ सकते हो. You can precisely find out the vertebral point corresponding to the actual body vertebra if it is a problem in that vertebra. कोई आता है ना कि someone comes with MRI scans, the problem in lumbar 4 and lumbar 5, you can precisely find out the lumbar 4, lumbar 5 area in the ear. Okay. Someone is having numbness in the legs but they don't have pain. ऐसे patients आते हैं कि पैर में numbness है लेकिन pain बिल्कुल नहीं. That time we refer to dermatomes कि कहाँ से नसें निकल रही है, कहाँ तक जा रही है, कौन सी एरिया को सप्लाई करेगी. Which area of the spinal, which area of the body is supplied by which spinal nerve. उस समय we use spinal correspondence in the ear, bony correspondence as well as spinal cord and spinal nerve correspondence. ठीक है? So that time we require exact precise marking and location of the vertebrae on the ear, and we can do that. Okay. So anti-helix बहुत important है. And we can divide the anti-helix into each cervical, thoracic, lumbar, sacral parts. ठीक है? So the anti-helix. What is next? Now we have tragus and anti-tragus. So pinch your lobes again. आप लोब पकड़ो आपके और उसके ऊपर जाओ एक फिंगर से and find out again lobe is soft. Find out a little semi-hard and moving part. You can move it with your fingers and it is semi-hard, semi-soft, semi-hard. Okay, it is triangular in shape. Called as anti-tragus. This one. And the triangular or rectangular, it depends on person. कुछ लोगों में triangular होता है, कुछ लोगों में rectangular. Find out this on called as tragus, connected or attached to the face. Okay, ये tragus जो है आपके face को connected है, anti-tragus जो है आपके lobe को connected है. See this, एक finger से मैं पकड़ रहा हूँ. With my one finger, what I'm touching is my tragus. So this is a tragus which is connected to my cheek or face. Tragus. Right? I can move it with my one finger. Everyone can see? सबको दिख रहा है? Tragus. Okay. Now above the lobe, ये जो lobe है, lobe, you can also move your lobe easily. Just above the lobe there is a, जो मैं हाथ से pinch कर रहा हूँ. This is anti-tragus. So everyone now pinch your lobe first. Everyone pinch your lobe. Palpate your helix till it is inside. Palpate your helix. It is inside. Okay. Now with one finger, lobe के ऊपर anti-tragus. Touch the anti-tragus and move it. From there, go upwards so that you are on the anti-helix. Y-shape anti-helix. Right? Y-shape anti-helix. And you can pinch it. You can pinch the Y-shape anti-helix. Now, anti-helix, there is a diagnosis by touching. हम तीन तरीके से ईयर में डायग्नोसिस कर सकते हैं. If possible, I talked about the diagnosis tomorrow in a separate class. I want to have people the basics of diagnosis. So if you inspection, palpation and pressure or electrical diagnosis, तीन levels है, तीन तरीके है. Inspection just by watching, palpation by touching, and third is by probing or electrical device. So inspection, मैंने ग्रुप में आज एक फोटो डाला है. आप में से कितने लोगों ने देखा? हैंड रेज करिए. How many of you can see the photo in the group? Okay. Just see the photo in the group and tell me what you can find out from that. Okay, मैं इसके बारे में बात करूंगा. So palpation से आपको क्या समझ में आता है? Specifically for anti-helix. If you have a softer anti-helix, mostly आपके spine और spinal muscles में flexibility अच्छी है. If you have a softer anti-helix, your spine and spinal muscles mostly will be more flexible and more elastic and more healthy. Harder the anti-helix, if you pinch it and if you find it is like जैसे एक matchstick होती है ना, just like a matchstick, if you find it in terms of feeling, that I called a hard anti-helix. Then you will find that the person might be having issues with their spine. So pinch your anti-helix and find out if you have a soft anti-helix, semi-hard or good hardness is there in your anti-helix. Also check your left and right anti-helix. Just by pinching, you can compare your right and left anti-helix and see if they have a same levels of hardness or softness, or one is more hard than other. And tell me if you find it is same or one is hard than other. You can message. Do a message in the message box. Will it be soft like helix or little hard? Yes, it is not soft like helix. If the helix is 100% soft, anti-helix will be 50% soft or 60% soft. 40% hardness will be there. Okay, so message me, everyone, please. Everyone, please type a message if it is both the sides में softness same है क्या? If it is same, write down same. Check your right and left anti-helix and see if they have a same structure. Then you can say same. If right is hard, write down right hard. If left is hard, write down left hard. Okay. If you have same structure, same hardness, semi-hardness, softness, then it is good. If you have some difference, check out which side is more hard. Okay. आप चेक कर सकते हो और मुझे बता सकते हो कि कोई किसी ने लिखा है कि थोड़ा डिफरेंस है, तो क्या डिफरेंस है आप बताओ. इट विल बी वेरी हेल्पफुल फॉर द ग्रुप टू अंडरस्टैंड. किसी का है राइट हार्ड है ज्यादा लेफ्ट से. Okay, so seems it good because right side is minor difference. Okay. Keju, left heart. Dimple, left heart. So Dimple, आप बताइए आपको कोई cervical lumbar issue है क्या? Keju, do you have any pain issues? Pain in spine, pain in shoulder, pain in buttocks, pain in lower back. Okay, no, that is good. That is good. Because many times if you have a slight difference, it is coming in future. So do exercises. Your ear is telling you that if your right side is little harder than left, you might be having stiffness in your right side. Okay, Dimple, yes, you said neck and spine stiffness. Jyoti ji, left side comparatively slightly hard. Okay, so you people, Dimple and Jyoti ji, आप चेक करो कि आपको लेफ्ट साइड में कभी कोई ज्यादा प्रॉब्लम होती है क्या? क्या आपको ऐसा लगता है कि लेफ्ट में पेन है? Just simply palpating, just observing the ear gives you good energy diagnosis. Okay, knee mein hai. Okay. If you have knee problem, okay, we'll see the knee areas later. So that is good. Let's go forward. हमने क्या क्या देखा? Lobe, tragus, anti-tragus, helix, anti-helix. Now the area between helix and anti-helix, everyone, area between helix and anti-helix. It is a small, like a pipe area called a scapha. All pains, Dimple says, what do you say, Dimple? All pains in left side of the body, only knee pain in right. Okay. So we did not check the knee. Knee is upside and वो हमने check नहीं किया. So Dimple has a little stiffness on the left anti-helix and she also has a left side body pain. That is very relative. That is very, very expected. Okay. तो Dimple, आपको एक काम करना है. आपको ना आपको कोकोनट ऑयल लगाओ और सुबह शाम lightly helix and anti-helix from down to up massage करो. Okay, do it for few days and see if you improve in your pains. And अगर आप improve नहीं होते तो पुणे आ जाओ, मैं पार्टी दे दूंगा आपको. Because you will definitely improve. I am very confident. Fine. So from in between helix and anti-helix there is scapha, and scapha is your hand. Okay. Okay. Now between helix and anti-helix, you have a scapha. And scapha corresponds to the hand correspondence. So everyone, feel your scapha in between helix and anti-helix. You have 1 minute. I'll come back. The Y of anti-helix, you have triangular fossa. So this is the anti-helix, and area in between the red is triangular fossa. Okay, it is called as navicular fossa or triangular fossa. ठीक. So the triangular fossa has the points for genitals. Triangular fossa has the point called as Schenman. Triangular fossa has the point for constipation. Triangular fossa has the point to help reduce blood pressure. Triangular fossa has the point for uterus. Triangular uterus and fallopian tube. Okay. Anti-helix has the points for the leg correspondence. Okay, this is your leg correspondence on the anti-helix. So anti-helix is your spine, buttocks, plus legs, plus sciatic nerve. Regulates the sympathetic and parasympathetic response in the body. It reduces the fight and flight activity. मतलब क्या है? हम बहुत स्ट्रेस रहते हैं, टेंशन में रहते हैं, तो हम फाइट और फ्लाइट मोड में रहते हैं और उसमें हमारा काम ठीक से नहीं होता. We cannot focus on the work. When we are relaxed, we can focus and do the work better. And this point shown in red color helps to balance it. It is called a sympathetic point. So यहाँ पे कभी-कभी यहाँ पे आपको मिलता है. And this is very important when we do a combination. ठीक? Right? So this is the part of the next week's point-wise syllabus, where we will be finding detailed points on the ear, and don't worry, it will not be that much complex. Itna complex nahi rahega. We'll find every part, the points containing inside, and the function of these points. Okay, ये सब हम next week से देखने वाले हैं. Okay. Now what remains is two conchas. What remains is two conchas. This area and this area, and in between. Right? So far, so good. Oh my God, slide not seen. I'm so sorry. I'm so sorry. One minute. Now see if it is visible. Okay, okay. Let me repeat. Let me repeat. See this. Yellow, blue color is Y-shaped anti-helix. So anti-helix में क्या होगा? Spine correspondence and upper part of the Y has leg correspondence. Lower part of the Y has buttocks and sciatica correspondence. And the last part is sympathetic, which is the balance of sympathetic parasympathetic nervous system. Okay. What is there inside the triangle is genital points. Points for male and female genitals, specifically uterus, testes, and hormonal part of it. Then we have points for, we have a point for constipation, to reduce the constipation. We have a point for helping to reduce high blood pressure. We have a point for regulation of the liver. Okay. In this anti-helical, in the Scapha, we have a hand correspondence. Shoulder, elbow, wrist, fingers. And in these two areas which remains, we call them Concha, C-O-N-C-H-A. Concha has thorax means chest, and abdomen, lower abdomen points. Okay. Okay. So everyone now take your small fingers. Small finger ले लो आपका. And with small finger trace your anti-helix till you have a small depression. Anti-helix पे जाओ, trace करो and find out a small depression inside. जहाँ पे आपका finger जाएगा, small depression, that is your triangular fossa. How many of you can find out the triangular fossa? Okay. Okay. ये आपको प्रैक्टिस से ही आएगा. सो आज का होमवर्क है, आपको एक स्केच पेन या जेल पेन लेना है एंड हर एक एरिया को सेपरेटली मार्क करना है. लाइक मार्क द लोब एरिया एंड टेक अ फोटो, मार्क द ट्रैगस एरिया एंड टेक अ फोटो, मार्क द एंटी ट्रैगस एरिया एंड टेक अ फोटो, मार्क द हेलिक्स एरिया, टेक अ फोटो. और आप बेसिक स्पिरिट से या नेल पेंट रिमूवर एंड कॉटन गॉज से इसको क्लीन कर सकते हो. So the homework for today, for everyone, whether you join the class to next time or not, I want you to learn this. ये जो knowledge है आपका, आपके साथ में रहना है, enhance होना है. Okay, so that once you understand the anatomical areas of the ear, you can learn from anything. Okay, you can learn from me, you can learn from books. कुछ भी हो, आपको confidence आएगा कि आप जो कर रहे हो सही एरिया पे कर रहे हो. So I'll be checking टिल टुमारो. अगर आप भेजते हो ग्रुप में तो मैं आपके ईयर एनाटॉमी के एरिया को चेक करूंगा और ठीक है कि नहीं है बताऊंगा. मेन ग्रुप जो हमारा है इसमें मैं भेजूंगा आपको. उसमें ईयर एनाटॉमी मार्क करके भेजना है और उसके नीचे उसका नाम लिखना है. ठीक है? हाउ मेनी ऑफ यू आर विलिंग? रेज योर हैंड. ओके, आपको इसके लिए जेल पेन लगेगा, बॉल पेन काम नहीं करेगा. सो आपको जेल पेन लाना पड़ेगा. सो buy 2-3 gel pens, one blue, one black. If you have other color gel pens like green, they're very important and easy for learning purposes. So आप इसको खरीदिए. कल तक आप मुझे अगर भेजते हो मैं जरूर चेक करूंगा. आपके कुछ सवाल होंगे तो भी करूंगा. जैसे मैंने कहा, केसेस मैं इस प्लेटफॉर्म पे डिस्कस नहीं कर सकता. इफ यू हैव एनी केसेस यू कैन आस्क in detail with detailed history in the group. I will definitely try to help. Okay. So I have 5 highs who are willing to do. What about the others? Are you really willing? You are welcome. Okay. Now what remains is the lower part of the internal ear, external ear का जो बीच का पार्ट है, सेंटर पार्ट के 2 पार्ट करेंगे हम. One is the lower part, one is the higher part. So lower part is called as lower concha, higher part is called as higher concha. Lower part has lungs and heart, and upper part has remaining, जो भी बचता है. Okay, remaining area. ठीक है? And this is very important because it has 12 organ points, and these organ points are very important. मैं एक चार्ट आपको पढ़वाऊंगा जो परसों लिया था. Each organ point is related to one function, one sense organ, one structure, one taste, blah blah blah. जो भी 5 element का जो चार्ट है बहुत important है. And with these organ points we can treat the organs, we can treat the meridians, we can treat द फंक्शंस ऑफ द एलिमेंट। तीन चीजें हम कर सकते हैं, हम उस ऑर्गन को ट्रीट कर सकते हैं, उस मेरिडियन को ट्रीट कर सकते हैं, और उस एलिमेंट के फंक्शन को ट्रीट कर सकते हैं। ठीक है। What remains are two more parts. इसमें दो पार्ट अभी बचते हैं, वो खत्म करके फिर हम सवाल लेंगे, सवाल जवाब, योर क्वेश्चन आंसर्स। ओके। क्या बचता है? इंटर ट्रैजिक नॉच। ट्रैगस और एंटी ट्रैगस के बीच में जो नॉच है वो बचती है, और हेलिक्स का जो स्टार्टिंग है ना वो बचता है। हेलिक्स के स्टार्टिंग में आपको बहुत इंपॉर्टेंट पॉइंट मिलता है, 0.0, वेरी इंपॉर्टेंट। एंड ये जो इंटर ट्रैजिक नॉच है इसके अंदर आपको मिलता है एंडोक्राइन। एंडोक्राइन पॉइंट बहुत ज्यादा इंपॉर्टेंट, बहुत सारे प्रोटोकॉल्स में आएगा। ठीक है। और ये जो 0.0 है इसके बाजू में आपको यू विल गेट पॉइंट्स ऑफ, यहां से आपको माउथ से लेके एंड तक, लार्ज इंटेस्टाइन तक का आपको पूरा डाइजेस्टिव ट्रैक के पॉइंट्स मिलेंगे। वेरी इंपॉर्टेंट, वेरी वेरी इंपॉर्टेंट। ओके। So this is the overview of ear anatomy and the tissues or organs associated with these anatomical points. I tend to make mistakes. Sorry. मैं आपको इसको 3D, जो 2 पॉइंट्स बचे हैं ना वो 3D में दिखा रहा हूँ, सो सॉरी। ओके, नाउ ये मेरा कर्सर दिख रहा है, कैन यू सी माय मूविंग कर्सर? ओके, गुड गुड गुड। सो this is the tragus and this is the anti-tragus, and in between that is U-shaped inter-tragic notch. ठीक है। इसके बाहर भी पॉइंट्स है, इसके अंदर भी पॉइंट्स है। सो इनसाइड ऑफ द एंटी इंटर-tragic notch, this is the area for endocrine, very important area। ये एक है, and दूसरा है ये जो 0.0 है, 0.0 से ऊपर का जो हेलिक्स है ना, दिस इज अगेन एन इंपॉर्टेंट एरिया। इसमें हमें 2-3 पॉइंट्स मिलते हैं, रेक्टम मिलता है। रेक्टम पॉइंट इज वेरी इंपॉर्टेंट फॉर पाइल्स एंड फिशर प्रॉब्लम्स, एंड डायफ्राम पॉइंट मिलता है। देन डायफ्राम पॉइंट इज वेरी इंपॉर्टेंट फॉर ब्लेंचिंग, हाइपर एसिडिटी, एज वेल एज reducing the bleeding anywhere in the body. Okay, so these are the overall ear anatomy and the points related to it. Okay. So अगर आपको कोई सवाल है तो पूछिएगा। I'll stop the share. Screen now, because after that I will show you a very innovative new method of using sound healings along with ear acupressure or any acupressure form, जो बहुत ज्यादा आपको हेल्प करेंगे। And I think there are some old friends who can share the use of two. I will be very grateful if you can. जो लोगों ने ये मेथड ट्राई किया है अगर वो शेयर करेंगे तो आई विल बी वेरी ग्रेटफुल। ओके, यू कैन टर्न ऑन द माइक वन बाय वन प्लीज। एक जब बात करेगा दूसरा नहीं करेगा। यू कैन आस्क क्वेश्चंस इफ यू हैव। सो नाउ यू कैन ओपन योर माइक, आस्क क्वेश्चंस।
2014 में मोदी जी
Yes, sir. हाँ बोलिए जी। आप एक बार शेड्यूल चेक कर ले सर। हाँ ठीक है सर, बाद में करेंगे। संडे को तो मैं कोची इन हैंड क्लास लेने जा रहा हूँ ईयर का, तो बाद में करेंगे इस रिक्वायर्ड। यस यस। ओके, सो किसी को कुछ सवाल है?
Sir, we are not added to group.
सर नमस्ते।
सॉरी,
सर थोड़ा एक साउंड हीलिंग का बताएं।
डॉक्टर पूनम यस, आई टॉक अबाउट द हीलिंग, साउंड हीलिंग। सकीना, व्हाट आप क्या कह रहे हैं? व्हाट आर सेइंग?
We are not in your group.
Okay.
How we can do the homework?
Okay. Right. Fine. I'm sending you the WhatsApp number in chat. Just send me hi, and I'll add up you in the group.
Okay. We are MRF students. We are not
Right.
anyone in your group.
Right. So you can send up a ping me a message. I'll send you the group link.
Okay, thank you, sir.
Okay.
सर हील की लोकेशन भी बता दें।
आपका नंबर क्या है सर?
मैसेज किया मैंने, मैसेज बॉक्स में।
Okay.
Yes.
Thank you, sir.
Sure. मीता जी, yes. Tell me.
यस सर, हील लोकेशन फॉर प्लांटर एड़ी के दर्द के लिए।
Yes, we can treat.
या तो सर उसकी प्रॉपर लोकेशन मुझे मिल नहीं रही है इसमें, मतलब समझ नहीं आ रही है।
Yeah, that's why the class is, no. To understand the proper location of each points, that's why the class is.
Okay sir.
Yeah.
सर साउंड हार्मोनी का एक फीडबैक देना था।
बोलिए।
सर मेरे हस्बैंड को मसल पुल हो गया था आर्म्स के नीचे एक्सिला में, तो उनको चेस्ट में काफी पेन हो रहा था, तो मैंने मसल फटीग का उनको साउंड हीलिंग दिया एंड विद इन हाफ एन आवर उनका वो पेन सबसाइड हो गया।
Very nice. Thank you. Actually, this muscle fatigue healing जो है ना, this is the ideal healing for a person. Either आपको जैसे आपने कहा कि some leg is pulled or some minor injury, and also it is very good for the people who go to gym for recovering the muscles. So in my patients, I prescribe this healing for the gym people to use it every day, so they recover the muscle fatigue very fast. And even the athletes, I consult basketball team and other athletes, and they use it regularly. If they have back-to-back matches, they get muscle recovery very fast. So I'm very happy for you.
May I ask something?
Yes, you can.
So in sound harmony, the spine treatment and the digestive healing, they both work really well and very fast. I have applied on myself and I have seen the results. So they are very nice.
Sir, what is sound harmony treatment? We don't know.
Yeah, I'm going to explain. Okay, so let me show. Basically, I am a doctor of Ayurvedic medicine. Okay, and in Ayurveda, just like in TCM, we have 5 elements, and with each element we have associated energies. So when we learn, my father is also was a Vaidya doctor, and my grandfather and great grandfather all were Ayurvedic doctors. Me and my wife are also. So we were I was discussing with my father and my wife that we are doing a medicine treatment, which is one element dominant. Okay, what about the other elements? So my father said there are other elements and we can heal with them. But these methods are not developed. So like sound, Indian ragas have good effects on the body, everyone knows. Okay, there are research papers also. But they are not so much developed that if you have hyperacidity, do listen to this raga or that raga. Now people are developing it. Okay. So then I realized that sound has power, magnetism has power, lights has their own power. That is a starting of the thing I created. Then I learned acupuncture, I learned electroacupuncture, I learned about the frequencies. So the frequencies and the sound, I kept on researching, and then I learned many frequency schools, many methods of sound, magnetism, light therapy, laser therapy delivery, and we came up with our own system, which is completely Indian, our own method of using sound, magnetism, structured water, and in future light therapy for yourself, and if you're a professional, for your office use. So the best part is for the sound therapy, you just need to have one small toy smartphone. So if you have a smartphone, I'm sure you have, you'll be able to use the healings for yourself and family, and there is a provision to send the healings to your clients also in a higher plans. So what I'm offering is, I'm offering a membership of Sound Harmony Healing System to you with this class, which is starting from next week. So I would like to show you what is Sound Harmony and how I came to that, and it is complete proprietary copyrighted system, so that if I'm saying that you can use it for yourself, you can definitely use. There is no problem, or there is no, I would say, 1 minute. Okay, let me share my screen. Okay, so this is soundharmony.in, a website, as well as you'll find the app in the Play Store soon. It has principles of using the sounds or the PEMF, pulsed electromagnetic healing system, through your smartphone. आपके स्मार्टफोन को कनेक्ट करके साउंड थेरेपी या फिर मैग्नेटिक थेरेपी आप यूज कर सकते हैं, एंड इट हेल्प्स यू टू normalize the body energies. Third part is structured water. You can charge your drinking water with the help of sound magnetic fields, with the help of healings here. So Sound Harmony has healings. See the photo. You can keep a speaker over a glass of water and charge your water, and if you drink it regularly, you will feel the effect. Okay, so we have different healings for different body problems, different symptoms, and for different systems. So if you see, there are healings for different body structures, and simplest method for example, someone has mouth ulcer, you click on the healing. In the select option, you can select how do you want to play. So if you select sound, you can play this healing through your smartphone or through a speaker connected to the smartphone. आप smartphone use करें या फिर उसको एक speaker connect करके उसको use करें. Once you play it ना, it will create buzzing sounds, going as a sound आएंगे. Then what you do is you minimize the volume to say 15 or 20% only. मतलब barely audible. सुनाई दे रहा है कि नहीं दे रहा है, इतना कम करें. And then keep the device, either your smartphone or the speaker connected to the smartphone, next to you. आपके body के पास में रखिए. That's it. Body will receive the signals and it will help you to restore the imbalance. This happens with the sound. If you select water, what you have to do is you have to take a glass of water and you need to have a speaker. Keep the speaker on the glass of water and again play the healing with 50% volume, means that will charge the water and you can drink the water. And what you will feel is the water changes its taste. Okay. And the third option, which is 10 times powerful than sound, is the coil, that is magnetic emitter, which I rent or sell to people. That magnetic emitter fits to your smartphone. So I don't encourage people to start with magnetic emitter because it has a cost. With sound, you can use the healings with your smartphone, which you already have invested, and feel it and try it out. If you find it is useful for you, then you can think of a magnetic fields, magnetic emitters, which are way faster than sound healing or water healing. But always start with sound and see how they work for you. So with this class, I am providing you a silver membership of these sound healing systems. That means if you see here, you have free. That means anyone can use the healings all the time. We don't charge anything for it. Bronze is same free healings, but you have to sign up on the website. So if you go to the account, I have already signed up, but you will see that you will see a login tab here when you are not logged in the account section. So you create an account, just enter your mobile number, you'll get an OTP, fill up the name, age, blah, blah, blah things, and sign up. So your mobile number will be your login ID and a password. So that whether you go for the course or not, you will always be able to use this 3 and bronze healings anytime. No commitment, no fees. You are welcome to use after you use for at least 15 times or 15 days. Means I tell people कि कितने बार use करना है, कम से कम 15 बार use करना है. So 15 days if you use it once in a day. 7 days if you are using twice in a day. तो अगर आपको फायदा होता है तो you can write down your feedback here. Okay. So we have healings for different body issues. We have healings for meridians, like kidney meridian. We have healings for some TCM conditions. Okay. You will see there are TCM condition healings, by syndrome, stomach heat, and we are expanding slowly. So we have healings for digestive, mental, urinary, reproductive. So these healings work perfect with whatever healing systems you are using. If you are using acupressure, acupuncture, color therapy, homeopathy, physiotherapy, whatever you are doing as a healer, you can add up these healings in your office. In gold membership, you can send the healings to your clients and they can use it at their home also. Okay. So I'm offering a silver membership, that is you can use the healings for your smartphone in your office. Okay. So these healings will be available for you for 3 months. आप इसको 3 महीना ट्राई कर पाओगे. And मैं इसके बारे में वेबसाइट का नाम भी मैसेज बॉक्स में डालता हूं, आप देख सकते हो. Okay. So simple है. Sign up. Once you sign up, go to a healing, select a style as sound, and hit the play button. Keep the smartphone next to you. Reduce the volume till it is lightly audible. थोड़ा हल्का आपको सुनाई देना चाहिए, लेकिन वो bother नहीं करना चाहिए. It should not bother, irritate your ears. इतना आपको कम करना है. Same, take a speaker, connect it to your smartphone, keep it over the glass of water, and charge the water, and you can drink it. So this is how you can use it through a smartphone or a smartphone connected to speaker, which is a better way of speaker ko add karna, better option. And you can also charge your water with it. And this is the complete innovative way, first time in India, and we have a complete copyright over it, so that in future, if you feel that you want to have a business tie-up with us, we offer collaborations also for the professionals. Okay, so this is about the sound harmony, which is my child, and I use it very well with acupressure acupuncture pumps. Okay, it enhances the results of both systems because energies are balanced well with this. Okay, so I think दो तीन लोगों ने मुझे पूछा था, tell us about sound harmony. So this is about sound harmony. Chetana ji, Shankar madam.
Yes, sir. Yes, sir.
Okay, this is the basic. I will have a separate 2 hours lecture on sound harmony, how the sounds work, why the sounds work. Not because Dr. Kedar says. No, no bullshit. We have research database. We have clinical trials on the sounds and magnetism, and then I'm saying it. Okay. So this is very much science backed and used all over the world, but innovated through a smartphone, which is new. Because if you find out sound healing devices, PEMF devices, they have a separate hardware which costs around $1,000, 80,000 rupees. This good devices start with 1 lakh rupees in India. Okay, so you can use it through a smartphone. With the membership, you can use it for 3 months and see if it is helpful for you. Okay.
Thank you, sir.
Sure. Any questions?
Sir, I had tried this sound therapy yesterday.
Okay.
And I didn't know that it had to be toned down. I just heard it on a high sound, and I was not comfortable at all. And
You
later
won't.
I did, yeah. I kind of felt back the pain, which I wanted to relieve myself, but I thought it came back. So
Sorry, you kind of what?
I felt the pain came back.
It was released and came back.
Yeah.
Okay,
But,
that's why you have to use it for 15 times at least. So 7 to 15 days every day.
Okay. Okay.
Right. And now keep
Does
the
that
volume
make a
down.
difference when you need it on a higher volume? Does it make a difference?
No, it is not required because we don't want to hurt our ears. And it is not a ambient music, it is a sound. Okay, so
Yeah.
keep the volume low because it is signaling to the body. So if I say your name, Dipti Kapoor, and if I shout Dipti Kapoor, anyway I'm talking to you. Right? So it is a signal, whether it is high volume or low volume, when we deliver it through the sound.
Okay.
Body will still receive the signal. But when we use the magnetic fields, then definitely we need a higher volume. That time we connect a small emitter, magnetic emitter, to a smartphone. Let me check if I have it. 1 minute, I'll show you because that will help to clear the doubts. 1 minute. Okay. So we have created a magnetic emitters. They fit to your smartphone, and then we turn up the volume highest, and then we keep the emitters on the body so that magnetic fields penetrate the body around 6 inches deeper. That's why it is 10 times faster than sound, and it helps to reduce the problems very fast. Okay, but sound therapy is ideal because you play through your smartphone, keep the volume down, keep it in the pocket, and do your work. Simple. Okay, so even if it takes time, a bit time than magnetic fields, it can be used all over the world. Anywhere you need a phone, you need an internet, and you can tune to the sound healing. Okay. So Dipti ji, continue with what you are doing for few days.
Okay, but sir, I just have just a simple little doubt. As I was saying for arthritis, arthritis is problem of inflammation of the body.
Yeah.
That's exactly it said. And it's an autoimmune disorder. That's what is said about arthritis, right? Rheumatoid arthritis.
Kind of. I will suggest you one healing for it. Arthritis microbe healing. You try this out for
Yeah.
at least a month. Okay, and it is 60 minutes. Every healing will have a different timer. Okay. So use it twice a day for at least a month. You get results or not. Because there is a theory that autoimmune disorders come up with latent infection. And if you can clean it out, then autoimmune body can fight with the autoimmune. That is a theory, and that has much, I would say it is much legit. So use this healing for at least a month, twice a day.
Twice a day, at least a month.
At least a month. Okay.
Okay, sir. I'll try that.
Yes. Surely. Okay, so we will be starting the actual points class on 23rd. I think it is Tuesday. From Tuesday, we'll be having a point-wise location class, and I invite you all to join in and also try the sound healings. And I will be very happy to see your progress. Anyone has any sharings, any questions?
Sir,
Yes.
from 23rd September till when is this? And
Till
timings?
23rd से लेके 28th तक रहेगा. If we don't cover up the portion, 28th is Sunday. I think I'll take a break on Sunday. So 29th तक रहेगा. If we don't cover up the portion, I can extend it to 1 or 2 lectures. And if you miss anything, you get a recording. Access to a recording.
Okay, so it's from 3 to 4:30, right, sir?
Yes.
Okay, thank you, sir.
Sure. Okay, so if we don't have questions. Poonam ji, you want to ask something because your hand is raised in there.
Yes, sir. First time I have heard about this concept, sound therapy.
It is very
So
new.
I also want to try this. You have told me the application in that all. I will try.
Definitely. Okay,
Thank you, sir.
sure. Anand ji, yes, you want to talk? You can unmute yourself.
सर रिव्यू देना था खाली फीडबैक था वो
Yes,
साउंड
please.
हार्मनी वाला
Yes,
तो
please.
आई हैव गिवन वन म्यूजिक एंगर मैनेजमेंट वाला
Anger management, yes.
दो चाइल्ड थे जो मैंने डिस्कस नहीं किया था कि इरिटेबिलिटी बहुत है
Okay.
तो
मैं सबको दिखाता हूँ. Because this can be used by anyone because it is in the free section. So anger management, yes, sir. Now,
ये 4 दिन हुए हैं 2 स्टूडेंट को मैंने दिया है छोटे बच्चे ही है
okay,
तो एक तो उनका स्लीप इम्प्रूव हो गया सर
very nice. Okay.
और जो चिड़चिड़ापन था उसमें भी 30-40% की कमी आ गई
Really?
उनकी हाँ,
I'm really surprised.
उनकी मदर बहुत हैप्पी है कि भाई तुमने ये क्या कर दिया
Okay. I'm so happy because this is, see, emotions are difficult to treat. Emotions, क्योंकि mind is difficult to access, right? So I'm so happy that इतना हो सकता है कुछ दिनों में. Thank you. Okay.
सर इसको क्या डाउनलोड करना पड़ेगा इसकी ऐप को?
नहीं, अभी तो वेबसाइट है. ऐप इसका फंक्शनल नहीं है. It will be functional next month.
So we can hear it through the link that you have shared in the group.
Yes, soundharmony.in. मैंने ग्रुप में लिंक भेज दी है. जो हमारा व्हाट्सएप ग्रुप है वहां पे भी लिंक है. मैं शेयर कर दूंगा once again. You have to create a free account. आपको जाके वहां पे एक लॉगिन का ऑप्शन आएगा या साइन अप का ऑप्शन आएगा. You have to create a free account. Just follow the steps. Give your phone number, name, and everything, and you create a free account.
Sir, free account for how many days?
See, sound is free, and in the healings, there are two sections, free and bronze. They are free forever, no commitments, nothing. आप इसको जब चाहे यूज कर सकते हो, और जब तक साउंड हार्मनी वेबसाइट है, you can use it. Okay. What you will be getting with the class, with the paid class, is first two types of free and bronze healings plus silver healings. The silver healings are mostly, they have healings for your body organs. So when I say we will be treating the kidneys, you can use the sound healing for like kidney healings. When we say intestine, you can get the healings for the intestines. So this membership is offered for 3 months. आपको 3 महीने का membership इसके हाथ में मिलेगा. So that you can try it for yourself, your family well. 3 months is enough time to try and test it. Okay. So shall we stop for today? I'll be seeing you on 23rd, 3 o'clock. We'll be starting the point-wise class from 23rd. Thank you so much, everyone. See you.
Thank you, sir.
Thank you, sir.
Thank you, sir. And welcome to MRF.
Thank you, sir.
Next is 21.